Good afternoon, everybody. So today's topic will be Megaliblastic Macrocytic anemia. Let us start with the few questions. Is macrocytic anemia the same as megaloblastic anemia? You should understand, because when you are given the case of anemia, it is generally given if it is uh, in the war, and it is a difficult case anemia because it is very vast, and generally you are asked what is the definition of anemia, and that's why I started with a few 2-3 questions. Then we will start with the some topic. Is the macrocytic anemia the same as megaloblastic anemia? You must know it. The macrocytic anemias may be megaloblastic or non-megaloblastic. This is not synonymous. This distinction can often be made only on the blood film. Okay, so this is not synonymous. Then next question, because why I have started with the questions, because then you will understand in a better way. The next question is what causes megaloblastic anemia? The megaloblastic anemias are due to the deficiency of folate, that's B9 or B12, vitamin B12. Because their deficiency causes a failure of DNA synthesis and thus result in the impaired cell division. The DNA synthesis impaired in the bone marrow by manufacture the RBC. The next question is what causes non-megaloblastic macrocytic anemia? Megaloblastic is due to B12 and folate. Then what is non-megaloblastic? Most often these are the conditions. That's the alcoholism, liver disease, bone marrow, maybe aplastic anemia, you can say, liver disease, alcoholism, and myelodysplastic syndromes. These are the common causes which are the non-megaloblastic macrocytic anemias. Then, how you will distinguish from the film between megaloblastic and non-megaloblastic macrocytic anemia? The macrocytes. I will tell you what is the definition of the macrocyte later on. Why I started with the question, because you will understand in better slides. These questions should come into your mind. Then you will understand. A macrocyte in megaloblastic anemia tend to be oval with associated hypersegmented neutrophils and megaloblastic erythroid progenitors. In non-megaloblastic macrocytemia, the macrocytes are round. You can see in the. Now, I start with the topic. This is just a history. It started with some initially pernicious anemia. Then somebody has discovered the liver preparation with the patient become all right. Then some postulated there's an interesting factor, right, which is secreted by the parietal cell of the stomach. Then somebody added that it is treated with the folic acid. But this is the same thing. And then B12. So megaloblastic is characterized by abnormally large nucleated red cell precursors called megaloblast in bone marrow. Megaloblast is to the imbalance between the cytoplasm and nucleus due to improper and defective synthesis of nucleoprotein DNA due to the deficiency, and the most common cause is B12 and folic acid deficiency, which lead to the defective DNA synthesis. So you can see these are the So this question is generally asked when you are say that this is the macrocyte or macrocytes. Then normally you are asked what is the normal size? Normal size in the Viva are measuring the RBCs. The unit card is FL, femtoliters. Is used to measure the size of the RBC. What is the 1 FL? It is the 10 to minus power 15 of a liter. Very small. Normally the RBC are between 80 to 100 FL. FM is femtoliters. Which are larger than this size are considered to be macrocytic, and which is less than this size are microcytes. So you must remember the normal units of the measuring the RBCs. They generally asked in some Viva if you have the case of anemia. This is a non-megaliblastic. It's round cells, hypercommanded cells, blood film. So vitamin B deficiency causes damage apart from the anemia, DNA synthesis in the bone marrow. It also causes damage to the myelin in the peripheral nerve, spinal cord, and brain. And folate deficiency generally lead to the weight loss, nervous instability, not damage to the myelin as it causes by the deficiency of the vitamin B12. These are the other causes already we have said to you. What are the normal sources of vitamin 12? Microorganisms in soil, water, animal intestine, man and animal intestine lumen, but not most of the are excreted in the feces. Non-vegetable foods, they are rich, especially muscle, liver, kidney, oysters, fish, egg yolk. The only vegetable source of vitamin B12 is pulses, legumes. The dairy milk is also in smaller amounts. The daily requirement of B12 is 1 to 3 microgram, which increased in the pregnancy and the lactation. How the vitamin B12 is taken, it is absorbed. That's also important. Generally, you are asked. The colonies for food are found in the inactive. It is released by cooking or by the proteolysis in the stomach and the intestine, which I will show to the next slide. It's not soluble. So absorption depends on the various transfer factors, which we will discuss in the next slide. So this is a vitamin B12. This intrinsic factors combined. Okay, so certain processes. Okay, then it is absorbed, goes to the blood, and carried by the transcobulamine. The vitamin B12 is attached to a protein molecule. Okay, let us read the statement. And can only be absorbed by body after being split from the protein, which I told you already. By hydrochloric acid or in the stomach or by during cooking. In order to absorb B12 in the terminal ileum, this is absorbed in the terminal ileum. Hence, these stomach parietal cells are produced a glycoprotein after the intrinsic factor they attach to it, and it goes to the terminal ileum. Here it is absorbed, go to the blood, carry with the transcolamine, go to the tissues, and help in DNA synthesis, especially RBC. The deficiencies can be due to Addisonian pernicious anemia. Pernicious anemia, which I told you in the history, it started with the pernicious anemia diagnosis. That gastric mucosal damage because the intrinsic factor is not formed. Malabsorption, of course. Blind loop syndrome, again, the same factor. The nutritional deficiencies, which is very common in our country, and in pregnancy and infants, you can but see might be seeing on the very on the television due to the nutritional deficiencies in some areas how the small children are anemic and very weak. Of course, there is demand both in the pregnancy also, that it is in poor families. They don't have access to the this good nutrition, and they go to anemia. You might have go to the ANC, antenatal care, and see the most of our patients means the mothers which are coming to that ANC are anemic. These are general symptoms, just the usual symptoms. Also, appetite, weight, bitter nails. Of course, because the oxygen is less, the heart rate is more, heartbeat, diarrhea, patient feels fatigability, of course, pale, which is generally you will look on the lips, eyelids, tongue, shortness of breath, poor concentration, confusion, memory loss, and numbness in the peripheral limbs due to the myelin is not formed also, which I told you initially. It helps in the formation of myelin. This is the preparation which we are going to give, cytocobalamin. These are pink, you might have seen the injections. Pink color, or slightly reddish color. 100 microgram per ml. Drug of choice in pernicious anemia. 100 milligram once a week in pernicious anemia where intrinsic factor is not formed. So it is not absorbed if you give the good diet. In a pernicious anemia, you give up to for the whole life. 100 microgram once a week intramuscular for 8 weeks, then 100 microgram once a month lifelong. The other hydrocortisone 500, 100, 1000 microgram per ml. It has got better retention but can reduce antibody formation. It is used in the India but not in the USA. Other is methylcobalamin. These are the tablets are available. Then other factor I have told you that this is due to the deficiency of the folic acid. This is a folic acid formula. I don't go into the detail. It's also the tyroglycamic acids. It's called why this folic acid as is found at the green leafy vegetables. Source not like unlike the vitamin B12. It is found in the green leafy vegetables. Of course, in the non-vegetarian food like liver, yeast, kidney, egg, meat, fish, and dairy foods. This is also in addition to the B12 green leafy vegetables. Here it is much, that's why cooking is not done. This is mostly destroyed. That is supplemented that way from the inactive form to the active form, but it is destroyed. Daily requirement in adult is 500 to 100 microgram pregnancy and lactations. In pregnancy lactation, it's increased to 500 to 800 microgram. How it is absorbed? Folic acid, when it is given conjugates, I will next slide will clarify. Hydrolyzed to tyroglycamic acid by conjugates. Conjugates are enzyme present in the vegetables. Let's go to the last slide. Transport. Poorly given folic acid appears in 30 minutes as circulation. It circulates in the methyl tetrahydrofolic acid. Majority is loosely bound to the albumin. It is carried by the albumin where it is easily taken up by the cells. Inside the cell, then it is converted to tetrahydrofolic by cobalamin dependent. Vitamin C promotes THF from destruction. Total folate in the body is 5 to 10 milligram. Most of in the liver. This is how it functions. The folic acid, but the folic retardates DHFA, dihydrofolic acid. Then DHF reductase It is the tetrahydrofolic acid. Like this is the active form of the folic acid. This is how it acts. It mediates number of carbon transfer factors, homocysteine. Let's not go into that detail. The deficiency occurs due to the anemia, due to the folic acid, inadequate dietary intake, malabsorption, celiac disease, terminal ileum, tropical sprue, regional ileitis, biliary fistula, same thing. Now, chronic alcoholism, increased demand, it happens in the pregnancy and the lactation. And a few drugs also cause, like phenytoin. This is generally asked when the patients of epilepsy, you are generally asked the question when you gave the drug to the epileptic patients, you always say the phenytoin. Then they ask what is the side effect. One of the side effect is anemia, phenobarbital and pramiprazole. These preparation folic acid tablets are available 5 milligram. Dose is generally 5 to 20 milligram. And for prophylaxis, it is given 0.5 milligram per day. Form only will win the combinations. Okay, injections are available also in the folic acid. So folic is obtained. I don't think it's in the green vegetables. So this is a very small topic. So any question you want to ask me? Any question? You might have thinking that I finished this topic very fast. It's a very small topic. I didn't go into the details of the metabolism because generally they were not asked. Okay. One question is it? Nickel, Sony. What is your question, Nickel? Nickel, what is your question? You have not asked the question, you have only written your name and the roll number. What is your question? Question you have not asked. You have written only the name, your name. Anybody else? Nickel Sony. It is a question. Nickel Sony, you are not a question. So anybody else want to ask any question? Yes. Any question? All no. Nickel Sony is a trending the class. Anybody else? Because this, if this any patient of anemia is lying in the ward and generally available, you are always given anemia case and anemia ही सबसे थोड़ा difficult case होता है एग्जाम में. Okay, आप ऐसे ऐसे छोड़ जाते हो. Then they ask what is the definition of anemia? What are the mild, moderate, severe? What are the complications, which I have told you already? In this topic, there was not a iron deficiency anemia, so I have not touched it. Yes. Any question? If there is no question, then I will close here only. Okay. Thank you very much.